speaker mention using newsletters or emails or both for education purposes. Let's see what some of them had to say.
We've developed a electronic newsletter, if you will. It's called Compliance Conveyor. And whenever something new, for example, comes down from the Medicare program, or if there's a new government investigation that contains some insights that we want everyone to be aware of, anything that we think is of broad relevance that addresses an issue that we need individuals to act upon and do something different today than they were doing yesterday, we will write up a story regarding it in the Compliance Conveyor. So it's meant to be a quick hit. Don't spend a month thinking about it, writing it, editing it, get it out quickly.
We'll send out emails. We'll send out mass emails to let people know if there is a new issue that's coming out from Integrity Services that we want the facilities to be well aware of.
We have a coding HIM newsletter that goes out to our health information management and coding staff. We have a privacy and security newsletter that addresses privacy and security issues, and we have an ethics and compliance newsletter that addresses compliance issues.
The regulatory updates are basically the snapshots quarterly of the key issues that have been emerging, and that includes not only legal and regulatory updates, also if there was a big settlement or something like that, anything that's interesting that we feel is significant or could potentially have an impact on our business.
We also will use posters, elevator notices, and a variety of different print materials to get in the cafeteria, etc., but realizing again that you're only getting a segment of your organization. Depending on the urgency of the message, we will use a shotgun approach, deploying all of the different methodologies in order to make sure that our employees are getting the information that they need.
Getting people to attend education sessions is challenging. You can make it mandatory, offer little carrots like lunch, or big ones like continuing education, or simply make it convenient. Here's what our speakers had to say.
We also have something called Life Care University, and it's an online training course that we give. Anytime that we come up with new training ideas, we put it on Life Care University. And administrators out in the field, DONs, nurses, can go on to Life Care University and receive that training.
We keep every compliance education available in our catalog, in our learning management system. So if you want the CFO or you want the director of nursing to take that education, it's there and available for them. And we do get people that, you know, it's not mandatory for them, but they go in and take it from an educational perspective.
We have training programs that probably 30 to 35 hours of content that address just about all of our areas that we believe are high risk within our organization. The patient care areas, the billing, the coding. We've tried to break that into manageable 10 or 15 minute increments to help employees get through it more effectively. It is a requirement for our employees to complete that training and education.
I'd have to be honest to say the most useful tool that we have found is to make education mandatory. And sometimes that's what you need.
We don't have mandatory education for physicians at this time across the system, not to say some hospitals don't.
Getting people to attend education is always a challenge. So you need to be very careful of what you make mandatory, what you make required, and maybe what you make what's nice to know.
When it comes to tying mandatory education into performance metrics, it is at the point where we have incentive bonuses that occur at the med center levels.
On the incentive side, we try and certify every course that we provide for whatever types of credits are available. So for our physicians, we now have the ability under START to obtain CME credits.
We are always trying to make sure that we've got everybody's CEUs covered from that perspective, that we're, you know, for us, it's, you know, the best use of our budget, basically, you know, and be able to get all the ones that, like I have a clinical auditor that needs coding, and I've got the auditors that need accounting CPEs, as well as the, you know, the compliance people and the legal people. So we are sort of conscious about that, especially when educating our own team.
One of the unique things that we have in our organization are what we call our hospital president's compliance objectives. And this is a list of 25 to 30 objectively measurable metrics that the hospital presidents are scored on, and they're scored on training and education, orientation of employees to the program.
We also use food to get to people because people really like a lunch or a snack when they're attending courses as well. So we've tried to be creative and make it something that they feel is certainly valuable, but that we give them something as a token in return for that.
Many speakers are exploring new ways to educate beyond the traditional PowerPoint presentations. Being entertaining and creative pays off in better retention, positive reviews, and appreciation for making somewhat dry topics more interesting. Here's what our speakers had to say.
So one of the things we've recently been working with is a live theater group. And this group literally takes rotations around our campuses and actually works on the content area and gives the scenarios that are practical application for our individuals who are taking the training, and then helps them to see how it relates to them. We've had a very, very positive response to this, and believe it or not, the first couple sessions are difficult to get people to, even though it might be mandated. But after they hear about how much fun it is to go to these sessions, they actually are asking to sign themselves up for the session.
We do load streaming video on our system. The way that we do that, and particularly for the physician training that we do, we have medical directors and other members of our medical staff that we reach out and do a lot of training for them, and they need to be able to do it at a time that is convenient to them. So we run streaming video. We actually have a separate site that we set up, a secure site, and when we launch those training programs for that group of individuals that's doing it by video online, we send them a letter saying you can go to this link and here's your password and this is how you access those materials.
We've also been able to take those real life examples. We've created videos. We created a video that really we hoped kind of gave light to the topic, because it's really a tough topic to talk about. But we created a video that was lighthearted, but still got our point across. And this past year, we wanted to again change. This is, we have fun with this.
And we do them through viral videos. You know, everybody's gone to an electronic world. So you get your payroll, you can click on a viral compliance video. We have our pet bulldog, who is our privacy message, and that we're bullish on our patients' privacy. And as we see issues, then throughout the year, we'll put a viral video on our intranet for all of our employees to see.
Well, that brings us to the end of this program. We hope that it gave you some ideas on how to make your compliance education more relevant, innovative, and effective. Thank you for joining us, and thanks so much to our speakers.